Good afternoon. My name is Liu BAOYAN, come from the China Academy of the Chinese Medical Science. Today I want to introduce our study, effect of the electronic acupuncture on urinary liquid among women with stress urinary incontinent randomized controlled trials. This study we are last 4 years. Last year we are published this article in the American Medical Association in June 2017. We are now stress urinary incontinence is defined by the International Continence Society as the involuntary loss of the urine of the physical exertion, sneezing of the coffee. For the woman with stress urinary incontinence, the deep penetrating of the electronic acupuncture point in the lumbar scale region can significantly reduce the amount of the urine liquid. I think this, in the China you are now 2,000 years old. We have the book is Huangdi Neijing. This book, I think is a record about this. In the long needles, in the point, in the the lower, in the lumbar scale, can treat the blood disease. Now also we are to do the systematic review of the domestic in the China, the literature of the therapeutic effect of the acupuncture on stress urinary incontinence. This systematic review will show use acupuncture is very useful to the incontinent. And also we have made this pilot study, also showed the electronic acupuncture has been found to decrease the urine liquid. So this study is to assess the effect of the electronic acupuncture and the same electronic acupuncture for women with stress urinary incontinence. This study design, we are used multiple center to do this research. And also we are choose the central randomized and blind the participants and also evaluator. Use the same electronic acupuncture, the controlled. All of the center have the term, the hospital take a part this study. All patients, we are include the criteria. Yeah, according to this criteria, we are recruited the patient, and also this is inclusion criteria. We can look. All patients is 40 to the 70 age, and reported involuntary urine liquid on the effort, exertion, sneezing, or coffee, and the incontinent pant weight, again, is greater than 1 gram in the 1 hour PET test. And also exclusion, the age mixed and other type of the urinary incontinence. The randomized controlled, randomized use the stratified black, the randomized is a central randomization. The intervention, we are only use the 2 points. 1 point is a bladder 33, and the other is bladder 35. And the same electronic acupuncture point is the same. This active this point, but the only the beside 1 turn, the 20 minutes is beside, and also the deep. Well, usually you are treat this point, you need to use a little longer needles. The deep is 50 to the 60 the minute, and also the egg to the inside these eggs. Let the patient have the 得气, the sensation, have the soreness and the heaviness and the sensation. And then after this, if get the sensation, then you can use the electronic the needles. Usually we are use this electronic continue with 50 the Hz. The current intensity of the 1 to the 5 MA. Every session you need the retained needle, the 30 minutes. 30 minutes. Every week we are treat the 3 times. So all together treat the 18 times one session. We can use this electronic, this point. This are real acupuncture. These are the sun acupuncture. It's only it's beside the 20 minutes. And we are use the pant and also use this. You look like quite the same, but the electronic aperture is cut off, so no current. How to evaluate this effectiveness? Well, we are use the primary outcome is the change from the baseline in the amount of the urine liquid measured by the 1 hour pad test at the week 6. The 1 hour pad test, we are according to this. We can look. First, maybe you need to drink the liquid, and then you can let the patient to cough, to the moving, and to the other, and then to test this pad the heavy, and then to look the patient how about this. In the treat before, use this test after 6 weeks, and also to test again. And also we are choose the secondary outcome. Is have the 9 different this secondary mainly include the intentional consultation on the incontinence questionnaire, the short form, and also use the 72 hour blood diary. Let patients made this diary every day. And also we are evaluation the safety. We are choose the different look to all of the record this if have some the worst events. All of the this study we are choose the 250 participants in the two group in the one group. This is how to statistic analysis use the different intent ITT this method and also the mixed effect the models, and also have the mixed effect model with repeated method approach and others. Now we are looking at the result. We choose the 987 the patient, and from this patient we are choose we are according to exclusion criteria. We are choose the 504 the randomized the patient, and then we are randomized the two group. The one acupuncture group is 252, and the same the group also is 252. Is a two group. We can look the baseline. Now all the two group, the baseline from the is quite the same, from the age and from the education and others. All of this is quite the same. Is now this effectiveness. First, we look the primary outcome. We can look the 1 hour the test, the test, the urine liquid at the 6th week, they are the decreasing, the 9.9, but the same electronic acupuncture, this group, only the decrease the 2.6. So it's a very different. It's acupuncture. This group is a very good, effective. And also we are made the look this change in the second the outcome. We can look the in the change in the 2 weeks, the urine liquid adjusted the mean is electronic acupuncture and the same acupuncture. And also we are made if the patient the liquid reduce and the 50% and the 6th week. These are two group. In the electronic acupuncture group, have the 159 the patient, and the son only have the 52 the percent. So we can look acupuncture, electronic acupuncture. This group is a very good effectiveness. And also we have made this 72 hour incontinence episodes is according to diarrhea. And also we can look And also the reported the symptom, the severity, according to look at the different symptoms. And the two group also electronic acupuncture. This group is very good. And also the quality of life. This group. And the other. And also we are this design is a blended participation. So we are wanting to know this blend is if effectiveness. So we are also to do this test. We have the two group. One, we can look the patient if the blend the patient. From this the sample, we can look the two group also is quite same. They are now is a real acupuncture and a Sen acupuncture. They're quite the same.
Dr. Liu BAOYAN, you have got 3 minutes.
Okay. And also we can look the safety, the both group, all of the very safety. So according to this study, we are now electronic acupuncture had the significant and clinic relevant effect on the reducing urine liquid. The effect on the reduce the urine incontinence could persistent for 24 weeks after treatment, because we are treat the 6 weeks, and then we are observe after the treat. We are observe the 24 the weeks. So we can look if you stop the acupuncture, the effectiveness also still. We know why this can use to this acupuncture can treat this incontinence. One, we are according to the meridians. We know the bladder meridian attached to the bladder in the inside. And also in the outer involved the lumbar scale. So we can use in the outer the point to treat the inside the bladder problem. And also we are according to we are know this area where we can look from the acupuncture point can directly affect the pelvic floor, the muscle through the phrenic nerve, the treat urinary incontinence. So also we are look use this point also can treat in this area other different disease. So we are thinking this point is very useful to treat the woman, to treat this woman incontinent, and also can treat some woman other disease. Also is very good, effective. So we are hope we can to try to use acupuncture to treat this disease. Maybe you can get very effective. Thank you.